Hi, my name is Michaela Hickson. I'm going to be doing a basic IV insertion. Okay, so I would receive my doctor's order. I would compare it against my MAR. I'm going to pick my equipment that I'm going to need, the catheter size based on the time and duration that the IV is going to be in, as well as the purpose of the IV, if the person's going to be receiving a blood transfusion or surgery. I'm also going to assess the patient's labs to make sure that they're okay for a person receiving an IV, and I'm also going to look at and see if they have any allergies. All of that checks out, so I'm going to start prepping my equipment. Today I'm going to be using a 22 gauge catheter. I'm going to ensure that my IV prep kit is not expired, and it's not, and I'm going to ensure that my saline solution is not expired, and it's not. So I'm going to start by cleaning my saline. And then I'm going to attach my needle to my syringe. I'm going to withdraw 3 milliliters of air, take off the top of the needle cap, insert that into the saline solution, and withdraw 3 milliliters of saline. That's going to be used to clean the tubing. I'm going to recap that needle, and I'm going to throw this needle into the sharps bin. Now I'm going to attach the syringe to the tubing. I'm going to flush the tubing to ensure that I'm going to make sure that the tubing is open, and I'm going to flush the tubing to ensure that there's no bubbles in, air bubbles in it. Now I'm going to recap the tubing after I've flushed it and set that aside. That's ready to go in the patient's room with me. I'm going to take off a piece of tape and set that on the side of my tray to ensure that, to bring that into the patient's room with me as well. I'm gonna get some alcohol wipes, my tourniquet, my catheter, as well as some gloves to go into the patient's room. Now I'm ready to go into the patient's room. Hello, my name is Michaela. I'm going to be your student nurse. I would do my hand hygiene, and I would ask the patient, can you clarify your name and date of birth? The patient does. I'm going to ask if they have any known allergies. The patient does not. And I'm going to ask what the dominant hand of the patient is. The patient's dominant hand is their left hand, so I'm going to do an IV on their right hand. So I'm going to pick my spot based on a number of criteria. I'm going to choose the non-dominant hand, a distal site on that. I'm going to palpate. This looks like a good spot. I'm going to palpate to see if the patient experiences any tenderness. The patient does not. I'm going to avoid going over an area of tattoos, and I'm going to pick a spot that is not going to interfere with the patient's activities of daily living. I'm also going to I'm going to be sure that the patient has not had a mastectomy or a fistula on the side of the body, and this patient does not. So now I'm going to apply the tourniquet to the patient's arm 4 to 6 inches above the site of insertion. After I've applied the tourniquet, I'm going to clarify that I still can feel a radial pulse, which I do, and I'm going to wash my hands and apply my gloves at this point. This is an aseptic technique, by the way. So now that I have my gloves on, I'm going to take an alcohol wipe and I'm going to clean the site that I have chosen to do the IV in a circular motion starting at the point of insertion. So I'm going to go, circular motion going outwards. Throw that away, and then I'm going to let that air dry. Now I'm going to go and I'm going to get my catheter, and I'm going to pull the patient's skin in the opposite direction of the needle insertion, and I'm going to insert the needle bevel up at a 15-degree angle. I would warn the patient that they're going to feel a little bit of a prick, and then I would wait to see a flashback. Once I see the flashback, I'm going to advance the needle another 1/8 to 1/4 inch into the skin, and I'm going to advance the hub into the skin until it is pressed against the skin. Then I would release the tourniquet and apply pressure 1 inch above the place where the hub touches the skin. I would remove the needle and attach the tubing that I brought into the room with me. I'm going to ensure that the tubes are unclamped, and I'm going to verify the placement of the catheter by aspirating. I get a blood return into my saline, so I'm going to advance the 3 milliliters into the arm using the push-pause method. Checking to ensure that there's no swelling, which would indicate that I'm not in the vein. So while applying positive pressure, I'm going to clamp off the tubing. At this point, I can detach the syringe, and I would take my port and I would tape that into a secure position. I would go into my IV starter kit that I brought in with me, and I would get my tegaderm out. At this point, I would before I do that, I would clean up the spot because I did have a little bit of blood get on the outside, so I would use an alcohol swab to clean up around the port and the insertion site, or the hub and the insertion site. So now I would take my tegaderm and I would cover the hub as well as the insertion site. And I would be sure to write my initials, the date, and the gauge size. I would also document that as well as put how many attempts were made on the patient's arm as well as how the patient is tolerated. I would clarify with the patient that this is not in an uncomfortable position, and I would remove that. After I remove that is when I would write on the tegaderm. I would then clean up my area, being sure to throw all my needles in the sharps bin and complete my documentation. And that is the basic IV insertion.